Hello to all of you. All of you have done really well. You have given your 100% to your exams and your results will be very good. So don't worry about it. My best wishes are always for you, for your results. बहुत अच्छा होगा, सब बहुत बढ़िया होगा. Now let us recall the anatomy questions which came in this exam on 4th June 2022. So let us do the recall. Now over here in this recall, all the recall questions are on the basis of the questions which have been recalled by the students. So there can be slight variation in the options, but I have discussed all the options to my best knowledge. So whatever options were given by the students, there were some variations in different questions. So I have included everything in that. So let us start with this. And before we start with the recall over here, let us analyze the anatomy questions which came in this exam, FMGE June 2022. Now over here, total questions which were asked were 16 questions, in which 13 questions were image-based questions. So you can see that it is so important for you to see the images of the anatomy and revise the images again and again. So as I have told you earlier also that you have to revise all the images very well. Images for anatomy is always important. It is important for your learning also, and as you can see, for the questions also. Now, the questions which were directly repeated from the previous exam. One question was there, which was, we know, the posterior tibial artery question, and the questions which came from the previously asked topics. Means there were some topics in which some other question was asked earlier, but now in that same topic, some different question was asked. So there were 7 questions regarding that. And apart from this, if you have properly read your class notes and you have revised it well, there were 6 questions which came from the class notes also, which were slightly new questions, but it was covered in our class notes, and it included the basic questions also. They were very basic questions also which came. There were 2 questions which were new, and I would say that they were the difficult level question. Apart from this 2 questions, the rest of the questions you can very well do. So overall, the anatomy questions this time were more of direct questions and more image-based questions. And if you have seen the images, you have revised the images well, you would have been able to attempt it well. So now let us start with the recall. So first question over here, this was the question which was directly came from the previous exam, and you very well know this question. Now the question is, which structure is palpated in the given image? Now if you see in this given image, you can see very well that over here the hand is kept on the medial side of the foot, and which artery is palpated over here? We palpate the posterior tibial artery over here. Now, when we see this question over here, we have also discussed this question during the YouTube session, that is the 25 most important questions. So this is a screenshot which is showing that question, exactly the same question we have discussed in that YouTube session. And when we talk about this posterior tibial artery, you can see over here the hand which is kept over here. And now we say that where do you palpate it? Pulsation is between the medial malleolus and Achilles tendon or tendocalcaneus with the foot in slight inversion. So this is the point where you are palpating the posterior tibial artery. Now if you see this image, again we see this image. Now this artery which is shown over here, this is the posterior tibial artery. This is the posterior tibial artery. So we very well know that the answer of this question is posterior tibial artery. The other options, the students were not able to recall well because this question was so direct that when they saw the posterior tibial artery, they were confident enough that this is the answer. But the few recalled options I have mentioned over here. Now coming to the question number 2. Now this question number 2, this radiographic image was given for the brain, and this was the sagittal section which was given, and the arrow was put over here. Now these were the options. In the D option, there was a variation in the recall. Few were saying thalamus and few were saying hypothalamus. I have included both of them in the option. Over here, when we see this image, we have discussed this same thing during the YouTube session, that is 25 most important questions. This is a screenshot for that, and in that we have discussed the same image. Okay, we have discussed the same image over here, and we have marked all these structures over here. And when you see the arrow in this question is at this point. The arrow over here is at this point, and what is mentioned over here? What is mentioned over here? This is the pons. So the answer of this question is actually the pons. So let us see the image again over here. The answer of this question is pons. This expanded structure which is present over here, this expanded structure which is present over here, I will just zoom it for you. This structure is pons. The portion which is above it, this small portion which is above it, this is midbrain, and the small portion which is below it, this is medulla. Right, these are the parts of the brainstem, and we know that the expanded part of the brainstem is the pons. Secondly, it is in front of the cerebellum. So we very well know that this structure which is present over here is the cerebellum, and between the pons and the cerebellum, this triangular structure which is present over here, this is the fourth ventricle. So now the answer of this question was pons, and this was a very basic question. Only you have to know the parts of the brainstem, and as you go from above to below, you can very well tell that the expanded portion was pons. So the answer of this question is pons. Now let us come to the next question over here. Third question, very commonly asked topic, anatomical snuff box, and we have repeatedly discussed this topic, and in fact in the YouTube session we have discussed the same thing, the same topic over here, the anatomical snuff box, the YouTube session 25 most important questions, and in that we have discussed about the complete anatomical snuff box, and in that the anatomical snuff box we have discussed the boundaries as well as we have discussed the boundaries on the image also. Now when we talk about the boundaries of anatomical snuff box, let us see this, what is written over here. What are the boundaries? Medial boundary is formed by extensor pollicis longus, right? And the lateral boundary is formed by extensor pollicis brevis, abductor pollicis longus. Now the thing is that you should be able to identify it on the image. And when we see this image over here, let us see this image over here. Now in this image, the anatomical snuff box, one boundary is this, another boundary is this, and we very well know that this boundary which is more towards the thumb, yes, this is the lateral boundary. Okay, this is the lateral boundary, and this one over here is the medial boundary. So the medial boundary, we very well know it is formed by extensor pollicis longus. It is formed by extensor pollicis longus, and when we talk about the lateral boundary, it is formed by extensor pollicis brevis and abductor pollicis longus. Now over here in this question, the arrow was being put towards the medial boundary. The arrow was being put towards the medial boundary, and the answer of this question was extensor pollicis longus. How the arrow was put? The arrow was put like this. If you see this image carefully, it looks like that the arrow is going towards the anatomical snuff box. You can see the arrow is going like this towards the anatomical snuff box, but it is coming over here towards this margin, this raised tendon, and this is the medial boundary. This one is the medial boundary, and over here will be the lateral boundary. Right? So now the arrow is towards the medial boundary, and therefore what is the answer of this question? Extensor pollicis longus. The answer of this question is extensor pollicis longus. If the arrow would have been on lateral boundary, then the answer would have been 2, the extensor pollicis brevis or abductor pollicis longus. And in that you can go, you prefer extensor pollicis brevis if the lateral boundary would have been asked. So the answer of this question is extensor pollicis longus. Now coming to the question number 4. Yes. Now this question which we have discussed a lot of time in the class. Now this image was given. This is the posterior aspect of the scapula over here, and the muscle was present above the spine of scapula. So when you see this image, so let us first of all see this picture. Now this is the posterior aspect of the scapula, right? And now this structure, this one is, what is this? Spine of scapula. This is the spine of scapula, right? This is the spine of scapula. Very easy way to tell the muscles. The muscle which is above the spine, supraspinatus. The muscle which is below the spine, infraspinatus. Very easy to identify. So this muscle which is present above the spine, now this is supraspinatus, and this is the muscle which has been given in the question, right? So first of all, you should be able to identify the muscle. And the other muscle which is present below, this is infraspinatus. This is the infraspinatus. And apart from this, when we go towards the lateral side, the lateral border of the scapula, what are the muscles? This muscle, this one is teres minor, and the muscle which is present below, this is the teres major. Right, these are the muscles. We have identified the supraspinatus. The same thing we have discussed a lot of time during our class, and we have discussed and as well as identified these muscles a lot of time. In this image, you can see we can identify this one is supraspinatus, which has been given over here. So I will just zoom this image over here. Above the spine, you have the supraspinatus. Now, in this question, what they have asked is, what is the action which is performed by this muscle, by the arrow mark muscle? So let us see over here. This screenshot I have taken from the class notes only. And in the class notes, we have discussed about the abduction of the shoulder. When you talk about the abduction at the shoulder joint, abduction like this. So we say 0 to 15 degree by supraspinatus, 15 to 90 degree deltoid, and above 90 degree is trapezius and the serratus anterior. This you very well know. So over here, initiation of abduction. Which muscle is there? Supraspinatus. So what do you know? What do you understand by this? That supraspinatus is the abductor or doing abduction at the shoulder joint. Now, when you talk about the retraction, many students were confused that the answer is retraction or the protraction. Retraction, protraction, if you see the retraction and protraction over here, let us see. The protraction, we know one muscle mainly, which is serratus anterior. Okay, and when you talk about the retraction, it is by rhomboides minor, major, and as well as the middle fibers of the trapezius. So these are the muscles which are helping in that. So there is no confusion in this question. Very well we know supraspinatus we have identified, and the action which is performed by this is abduction of shoulder joint. Okay, the answer of this question is abduction of the shoulder joint, and this muscle is supraspinatus. This is the posterior view of the scapula. Coming to the next question, question number 5. Now this image was given. Now over here, this is a question asked from the previous topic again. Earlier the question was asked on pubic symphysis, and they asked that which type of joint is that. So that means that joints topic is important for you, and we have actually discussed it a lot of time during our classes. And over here again, now they have asked this joint. They have put the arrow over here, and they have asked that which kind of joint is this. Now let us see first of all over here. Okay, these are again the screenshots from the class notes only. Now when we talk about the fibrous joint, we have discussed that when we talk about the fibrous joint, it is of 3 types: suture, syndesmosis, gomphosis. Syndesmosis, it includes the middle. It includes the middle radio-ulnar joint. For the gomphosis, it is a tooth in the alveolar socket. So in the image also we have discussed this, that this joint is the syndesmosis, which is the middle, this joint, middle radio-ulnar joint, which is actually formed by this interosseous ligament which is binding the radius and ulna. And this joint over here is the gomphosis, that is tooth in the alveolar socket. So now when we are very clear that this joint, the same image was given in the question, and we very well know that this joint is a syndesmosis. Okay, it is a syndesmosis. Now if we talk about the rest of the options which are given over here, symphysis, synchondrosis. So cartilaginous joint, primary cartilaginous joint is also known as synchondrosis, and the secondary cartilaginous joint is also known as symphysis. So those are different. One more option was mentioned. Few students have recalled that diarthrosis word was mentioned. What is this diarthrosis? The diarthrosis is freely movable joints. Okay, and in this we include synovial joints. In this we include the synovial joint. So we very well know that the arrow is on the fibrous joint, it is not on the synovial joint. So this is also excluded. Thereby the answer of this question, syndesmosis. Okay, and this arrow is actually on which joint? The arrow is on middle radio-ulnar joint. So middle radio-ulnar joint is which variety? Syndesmosis, or we say it is a fibrous joint. Now coming to the next question over here. This was a slightly different question, but They have asked the basic thing only over here. If you try to read the question, it is the simple thing, or they have just asked the joints over here. Again, a question on the joints. So 2 questions they have come on the joints, and over here along with the joints they are also testing your knowledge of the upper limb. Now this image was given to you in which they have shown this movement. What is this? Supination, pronation. Now it says that which joint helps in the supination, pronation movement, or some students have recalled that it is just asking that which joint helps in the shown movement. Now the variety over here is given: pivot, saddle, ellipsoid, hinge, ball and socket. Now, when we talk about this movement, we very well know that supination and pronation. Now, the question was mentioning supination, pronation, and by the image also you can tell that this is the supination and the pronation movement. When we talk about the supination and the pronation movement, we know that it is by which joints? It is by the radio-ulnar. This movement, it occurs at the radio-ulnar joint. And if you just see the notes over here, we have also mentioned in the notes that the pronation and supination, it occurs at the radio-ulnar joint. So first of all, you should be clear that it is occurring at which joint? It occurs at radio-ulnar joint. Now comes the question that what variety of the of this radio-ulnar joint is. Now when you talk about the radio-ulnar joint, the radio-ulnar joint, it is of actually 3 types: superior, middle and inferior, right? In the middle, we have already discussed that this is the syndesmosis variety. Okay, we have already discussed syndesmosis variety. And when we talk about the superior, it is pivot, and the inferior is also pivot. So what do you understand by this? That either the option should be given pivot or the option should be given syndesmosis. And if you see the options over here, the options have been given pivot. This is the image which is showing the discussion of all the joints which we have done in the classes, and we have mentioned over here for the superior radio-ulnar joint that this is a pivot variety, and syndesmosis we already know, and the rest of the joints are also mentioned because the rest of the options which are having the ellipsoid, saddle, the examples of that is also mentioned. So now coming back to the question over here, we are very clear that which kind of joint is helping in the supination, pronation. If you look into the options, according to the options, now the answer will be pivot. Okay, the answer is pivot. Coming to the next question, question number 7 over here. Okay, now before coming to this, question number 6 again. Now few students were having a slight variation in recall of this question. They said, because the majority of the students were saying supination and pronation, so according to the majority, I have made the question in that way, but few students were there who were saying that this image was given. So I'm mentioning this image also to you. In this image, the arrow is at this point. Okay, and now if you see this arrow over here, this arrow is on inferior radio-ulnar joint. Okay, this arrow is on the inferior radio-ulnar joint, and when you talk about this inferior radio-ulnar joint, we have already mentioned what is the variety. It is the pivot type of synovial joint. It is a pivot variety of the synovial joint. So the answer will be again the pivot over here. So the answer of this question is also pivot. So the answer for this question, whatever image was given, mainly it was a supination, pronation. So the answer of this question is actually pivot. Coming to the next question. Now over here the vertebral levels of this image was asked. Now what was the question? They have given the image of the abdomen showing the division into quadrants. Okay, and we know the division into quadrants is by the 2 vertical lines, 2 horizontal lines. They said that the red line which is shown over here, or the red plane which is shown over here, it lies at what vertebral level? And in the recall, I could see that the students have confused the options with the another question which was asked about the umbilicus. Okay, so I have put all the options over here, all the variety of the options over here, and let us come to the conclusion that what will be the answer. Now let us see the first set of options over here. First set of options I have simply put like this: T12, L1, L2, L3. Right? And another set of options I put over here, which is according to like lower border, upper border of the various vertebra. One is this junction of T12, L1, then lower border of L1, upper border L2, upper border L3, and few students also said upper border of L4. So I have included all the options over here. Now let us see what will be the answer. Let us see what will be the answer. Now first of all, you should be clear that which lines are this. Now this line which is shown over here, this is actually the subcostal. This is the subcostal plane, right? This is the subcostal plane. This line which is shown over here is transtubercular plane. And the two vertical lines which are present over here, these are the mid-clavicular planes. Okay, these are the mid-clavicular plane. So that means we should be knowing what is the vertebral level of the subcostal. Now when you talk about the vertebral level of the subcostal plane, so basically we say it is lying at the level of L3. And if you want to know that upper or the lower border, so specifically we say upper border of L3. So subcostal plane is lying at the level of L3 and specifically at the upper border of L3. So the answer, either the options are given only simply L1, L2, L3, or if they are given as upper or the lower border, now the answer will remain L3. And specifically it is upper border of L3. Now let us see the class notes over here, which we have already mentioned during our classes. We have mentioned over here the quadrants and two vertical planes, that is the midclavicular line or the planes, and the two horizontal planes over here. Okay, two horizontal planes, subcostal plane and the transtubercular. The subcostal over here is lying at the level of L3, that is upper border of L3, and the transtubercular plane is lying at the level of L5, again the upper border. These are the two planes which are dividing the abdomen into 9 quadrants. Apart from this, the other two planes. Apart from this, the abdomen is having other two planes. What are that? One is the transpyloric plane, which is at the level of lower border of L1, and another is supraclistoral plane, which is at the level of L4, and specifically you can say lower border of L4. So these are all the planes of the abdomen. And specifically if I talk about the subcostal, so now we know the answer will be L3. So in both the options L3, we will be going for L3. Now over here, the vertebral level. Now we have come to the next question over here. This is a question number 8. Now over here also the vertebral level was asked. And now this simple image was given, the arrow was put over here. We very well know that this is the umbilicus. So that means we have to tell the vertebral level of the umbilicus, or the level of the umbilicus opposite to the vertebral column or along the spine. Now over here also few students were saying like T12, L1, L2, L3 was given, and more students were saying that such kind of options were there. Like either the junctions were given T12, L1, L1, L2, L2, L3, L3, L4, and or the borders were given like this. Now if we go to the previous image over here, we have already seen this picture. We know subcostal plane and transtubercular plane. Subcostal plane lying at what level? L3. Right, and the transtubercular we know it is lying at what level? L5. So we definitely know that the answer should be between L3 and L5 for the umbilicus. It should be between L3 or L5. And when we are talking about the umbilicus, so let us come back to this question over here. Okay, when we are talking about this umbilicus over here, so this structure is umbilicus. And what is the vertebral level over here? The vertebral level we say it is the junction of L3 and L4. Okay, the junction of the L3 and L4. And if by chance the separate vertebrae are given like L4, L3 like this, then we say L4 is more better answer than L3. So either of this is mentioned. Either it is mentioned between L3 and L4, or if separate vertebrae are given, you will go first answer for in that will be L4 and then you will go for L3. But in the options till L3 was mentioned. So if I come to the question again over here, many students have mentioned that the junction of L3 and L4 was mentioned, and the answer of this question will be the junction of L3 and L4, or you can say at the level of intervertebral disc between L3 and L4. It is the same thing. And if very few students, they were saying that separate options were given, in that case also the answer will be L3. Okay, in that case also answer will be L3. So it should be related to L3 or L4. And this is the answer over here, junction of L3 and L4. Now let us come to the next question, question number 9. Now this question, what is the question? A patient underwent the surgery of submandibular gland, during which, now they have given you that which nerve is injured over here. Okay, they have already given to you that the injury to the hypoglossal nerve has occurred. Now, which of the following will be found in the patient? If we see the various options over here, deviation of the tongue to the same side or the same side of lesion, deviation to the opposite side, protrusion of the tongue, or loss of general sensation in entire 2/3 of the tongue. The option D, very less students were able to recall. These options, A and B and C, these are the main options over here. And when we see this option, we clearly know the answer. Yes, we clearly know the answer over here. Now, if we see this image, this notes over here, hypoglossal nerve injury. Now, when the hypoglossal nerve injury is there, I will just zoom it for you. For the hypoglossal nerve injury on the side of lesion, okay, on the side of the lesion, atrophy is seen, and as well as when you ask the patient to protrude the tongue is deviated to side of the lesion, that is to the same side of the lesion. So, this is one of the previously repeated topic over here, and the tongue is deviated to the same side of the lesion. Now, when you talk about the hypoglossal nerve, this is supplying the muscles. It is not related to the sensory supply of the tongue. For the sensory supply of the tongue, anterior 2/3 lingual nerve and the chorda tympani, and towards the posterior 1/3 glossopharyngeal, towards the posterior most part vagus. So, in no case it is related to the sensory supply. So, the answer of this question is deviation of the tongue to the same side of lesion. Let us come to the next question. The question number 10, it said that the patient presents with mandibular hypoplasia. Now, the keyword over here is mandibular. The keyword over here is mandibular. Some students, they have recalled that the question was given that the boy has developed, there is a hypodeveloped mandible with a small chin. So, basically the thing is over here that the mandible is not properly developed. Okay, the mandible is not properly developed. So, the point is, this can be due to defect in which of the arches. The development of which of the arches will be having the defect, which is leading to the defect in the mandible. And we very well know, when we talk about the first arch, we know these are the structures which are derived, which are developed from the first arch. And let us see over here. Yes, M. M is the predominant letter for the first arch. Any structure starting from M, it is coming from the first arch. And you can see very well over here, mandible. The mandible develops from the first arch. So, if there is any defect in the development of the first arch, it will lead to the defect in the formation of the mandible. So, coming to the answer over here, we very well know what will be the answer over here. The answer over here is there is defect in the first arch. Now, coming to the next question. What is the question over here? Question number 11. A man had a fall from height, landed on the outstretched hand, and the patient was found to have fracture of clavicle. Okay, they have mentioned in the question that the fracture of clavicle is there. So, you very well know that we are talking about which bone. Now, the fracture of clavicle, now the next thing they ask that what is the most common location for this fracture, or where can this fracture be? So, we very well know that what is the location of the fracture. These options were given. Okay, these were the options which were given. And let us just recall from these class notes. On the first day only of our class, we discussed the bones of the upper limb, in which we mentioned the clinical aspect which is related to the clavicle, that is the most common site of the fracture of clavicle is, what is it? Junction of medial 2/3 and lateral 1/3 at this point. Okay, so we very well know over here that what is the answer of this question? Junction of medial 2/3 and the lateral 1/3. So, this is the answer of this question. Coming to the next question, the question number 12. Now, this question number 12, it may look different to you, but if you try to read this question, it is a very simple question. Now, let us try to read it. It is saying that we have to identify the level of arrow marked region, or you have to basically identify this location. And these were the options which were given. Now, when you see this X-ray, let us see this X-ray over here. This we know is the X-ray of the neck from the lateral side. You have to simply count the cervical vertebra. We know it is, you are having 7 cervical vertebrae. So, start counting simply from above to lower side. This one is C1. This one is C1, right? I will just zoom this image for you. This one is C1. This one is C2. This one is C3, C4, C5, this is C6, and C7. And C7, you can very beautifully see that the spinous process of C7 is the longest. If you compare the spinous process over here for all the cervical vertebra, the longest spinous process C7. So that is why we say it is vertebra prominence. Now, let us come to the arrow over here. So the arrow over here is at what level? At this point. Okay, this is C3 and this is C4. So now we very well know that this arrow is between C3 and C4. Now the C3 and C4 will correspond to which cartilage? Okay, it will correspond to which cartilage? Now during our classes only we have discussed, this was like we were discussing the arteries, in that we have discussed this level, but we can use that knowledge over here. We have discussed over there that junction of C3 and C4. Okay, the junction of C3 and C4, it is present at what level? It is at the level of upper border of thyroid cartilage. Upper border of thyroid cartilage. So this junction of C3 and C4 is actually present at the upper border of thyroid cartilage. And if I come back to the options over here, let us see. This is, of course, this is not there. This is not there. We have to basically choose between C and D. And when we talk about C and D, we can very well see it is along the upper border of thyroid cartilage. So the answer of this question is C. It is C3, C4 and upper border of thyroid cartilage. Apart from this, in this image, if we see the other structures, we can very well see that you can visualize this hyoid bone also over here. This is the hyoid bone which you can visualize over here. Okay, now let us come to the next question. We have discussed till 12th. Now coming to the 13th. Now this section was given over here. It was a cadaveric section which was given over here. This image was given and you had to identify the arrow mark structure. And in this question, it was mentioned that it is a section of medulla. So this will act as a keyword for you. Now when you see this image over here, which we have already discussed in the classes, we always talk about the entire view of the brainstem in which this is the midbrain, this is the pons, and on the lower side this is the medulla. And in the medulla, on the anterior side, a very prominent structure is there which is pyramid. Okay, which is on the anterior side. Now if we take a section at this same point, then on the anterior side there will be a prominent structure which is the pyramid, and deep to it what it is present? Corticospinal tract is present deep to it. So let us see this section over here. Now first of all, let us see this image. This is the simple image of the anterior view of the brainstem, and on the anterior side at this level the prominences which are present, these prominences are known as pyramid. And as we go laterally, these prominences which are present lateral to the pyramid, this is olive. Okay, this is olive. And now when we talk about the section, if I take the section at the same level, now the section at the same level, the anterior-most prominence which is present over here, this is pyramid, and the olive is present lateral to it. Now on the lateral side you are having this olive, and deep to the olive you are having a nucleus over here. This nucleus is inferior olivary nucleus. This is the inferior olivary nucleus. Another option which was mentioned over here was a nucleus. The nucleus is actually present over here. This nucleus is hypoglossal nucleus. This is the location of the hypoglossal nucleus which is towards the posterior side. And one more option which we have mentioned over here, medial lemniscus. It is present at this location. This is the location of medial lemniscus. Right. So these are the locations of other structures, and when we see this image, now we very well know that this structure which has been marked over here, this is pyramid, right? This is the pyramid. So if you see this image which has been labeled over here, you can see very well this is the pyramid, this is the olive, deep to it the inferior olivary nucleus is there. Then this red colored structure which is shown over here, this is the hypoglossal nucleus, and this structure which is present over here, this is the medial lemniscus. And we very well know now that the answer of this question is pyramid. The other options which were mentioned, like if you have recalled thalamus, hypothalamus, putamen, the thalamus, hypothalamus, putamen, they are not present and in this section. Okay, and the rest of the options we have discussed. So the answer is pyramid. Now coming to this next question. This was a question of the thorax. Okay, a transverse section was given, a cadaveric section was given, and it was given in this way that the vertebra was on this side and this was the anterior side, and they have put the arrow like this is the posterior side, anterior side. So they have actually guided you that which is the posterior side, anterior side, right and the left side, right? Few students have said that it was like this, that the left side was shown towards that side. The main thing is that you should be knowing that which side it is. Left side, where is the left side, where is the right side, where is the posterior side, and where is the anterior side. That is the main thing. So now let us come to this image. First of all, whenever you see this section over here, you identify the vertebra. You know that this is the posterior side. And we also identify the anterior side. So when we see this section, we know that this is the posterior side. Okay, this is the posterior side towards this level. Towards this level, it is the posterior side. Just give me a minute over here. Yeah. Towards this side is the posterior side, and this side is the anterior side. And it is mentioned in this image that this is the right side and this is the left side. The arrow has been put over here. So I will just zoom this picture over here. The arrow has been put over here. Now, what do you see over here? That this structure is present just in front of the vertebra. Okay, it is present just in the front of the vertebra. The vertebra which is present over here like this, a structure is present just in front of it, right? And another structure you can see which is further in front of it. This structure which is further in front of it. And apart from this, what do you see? A section of the heart is seen. Okay, a section of the heart is seen. Now, what do you understand over here? The arrow is between the vertebral column and the heart. And if I talk you about the mediastinum, can you tell me which part of the mediastinum is this? Yes, this is the posterior mediastinum. The portion between the heart and the vertebral column is posterior mediastinum. So if you if you recall this image over here about the mediastinum, so let us see over here, we very well know that towards this side, this is the superior mediastinum, and towards this side, this is the inferior mediastinum, in which we say the area which is between the heart and the vertebral column, this is the posterior mediastinum, right? So now this means that the section is through the posterior mediastinum, and what passes through the posterior mediastinum, we very well know the structures passing through the posterior mediastinum. It is esophagus, vagus nerve, descending aorta, and thoracic duct, azygous venous system, sympathetic trunk. Now in the options, what I mentioned, esophagus and descending aorta. So we very well know that if the section is at this level, superior vena cava, inferior vena cava will not be there, ascending aorta will not be there. We have to basically decide between the esophagus and descending aorta. Okay, you have to basically decide between these two. Now I will just come back to this image and I will help you that how will you identify these structures. Now over here, because the section is at this level, on the anterior side heart section is there, and on the posterior side vertebral column is there. So the section can be over here, over here, over here, anywhere. Basically they are focusing on the posterior mediastinum. And now when you see this image, what do you see? Now you will yourself tell what do you see. Anteriorly you see the heart, posteriorly you see the vertebral column, and two structures in between. What are these two structures in between? This is the esophagus and this is the descending aorta. So the round structure just in front of the vertebral column is descending aorta, and it is slightly towards the left. Okay, it is slightly towards the left. And as we go anteriorly, you have a cut section of esophagus. So coming to the section again over here, let us zoom this section over here. This is the vertebral column over here, right? This is the vertebral column. This is the vertebra which is present over here. And now this section which is present over here, this is the descending. This is the descending aorta. And when we go in front of it, this component which is shown over here is the esophagus. Okay, this is the esophagus. And this structure which is present over here, we can very well tell this is the section of the heart. So the arrow has been marked on descending aorta. Okay, the arrow has been marked on descending aorta. So I have given you this image which is with the labeling over here, with the labeling, and the arrow has been put over here which is the aorta. So this was the question which was asked, and the answer for that question is descending aorta. Now over here only I will help you understand that where you can find the section of other structures which are mentioned in the option. You must be thinking that where is the section of superior vena cava, where is the section of inferior vena cava. Now, if you see this image, inferior vena cava, of course, will be towards the lower side. Okay. The inferior vena cava is almost at this location. Okay. This is the inferior vena cava, and the superior vena cava will be at a superior location, almost at this point. Okay. Almost at this point, the superior vena cava will be there. So that means if a section is at a very lower level, only then you are able to see the section of inferior vena cava also. And if the section is higher up, if I say the section is higher up over here, what you will see? Now in this situation, you will see the section of the superior vena cava, and along with that, you will see the section of this arch of aorta. Okay, this is a section of the arch of aorta. And in this, you can basically see, depending on the section, you can see the section of ascending aorta and the descending aorta together also. So in that, if the section is higher up, then we see the sections of superior vena cava and ascending and the descending aorta. But in the higher up sections, you cannot see the sections of the whole of the heart. The section which was asked in the question was this section, right? This section which we have already discussed, that it is between the heart and the vertebra. And we very well know that the answer of this question is the descending aorta. The answer of this question is descending aorta. I will just show you another image also. This was the image which was asked, and apart from this, another images for your knowledge. Okay, this is a section towards the higher side, towards the upper side. This is a section on the upper side. Some part of the heart can be seen over here. This is basically the pulmonary trunk. Okay, this is towards the upper side of the heart. So this is the pulmonary trunk. In front of the pulmonary trunk over here, you can see a big round section, and behind over here a big round section. This is ascending aorta and this one is descending aorta, right? The superior vena cava can be visualized over here. So if you see this section over here, this is the superior vena cava, and apart from this, a small structure which is present over here, this is a zygous vein just in front of the vertebral column, a very small structure. And where is you now you will say that where is the esophagus? This structure which is present over here, now this is the esophagus. This is the esophagus, right? So this is a section which is higher up. Okay, this is a section which is higher up. And if I take a section which is lower, very lower down, so over here what you see is actually diaphragm. You are actually visualizing over here. This is the diaphragm which you can visualize over here. And when you see this section, in this section, this structure is again the descending aorta, and another structure which is shown over here, this one, this is inferior vena cava. Okay, this structure is the inferior vena cava, but this section is very lower down. So these sections were not asked. This is just to make you understand that what are the other options. So the answer of this question is descending aorta, right? Descending aorta. Now let us come to this next question, question number 15. This was a transverse section of the brain was asked. This radiographic image was asked, and on the posterior side, some brown, this blackish round kind of, or like a round kind of structure was arrow marked, and the options were sinuses. The superior sagittal, inferior sagittal sinus, straight sinus, and occipital sinus. Now, before we identify it, I will just help you understand what are these sinuses. These sinuses are basically present around the brain, and they are all going to form or drain into the internal jugular vein. What are the sinuses? Now, when we talk about the cerebrum, we are having the right and the left cerebral hemisphere, which are divided by a dura mater fold known as falx cerebri. Okay, this is the falx cerebri, which is a dura mater fold. On the upper side of falx cerebri, there is a sinus which is known as superior sagittal sinus, and on its lower margin, you are having inferior sagittal sinus. Okay, they are just running parallel to each other. Then apart from this, we have this sinus which is present over here. This is the straight sinus. Okay, these are the sinuses which we are talking about. All these sinuses now are coming to this point. So this is, we say, a confluence of sinus occurs over here. Then finally, when we talk about the other sinuses, it is going like this. This is the transverse sinus. Then further, when it is flowing, this is the sigmoid sinus. This is a sigmoid sinus. And finally, it will lead to the formation of the internal jugular vein. When you talk about the occipital sinus over here, which is mentioned in the question, this small sinus which is present over here, this is the occipital sinus. Now the same sinuses, when we see in this image over here, we can very well tell that this is the superior sagittal sinus. A very small sinus present over here, this is the inferior sagittal sinus. And this one which is present over here, this is the straight sinus. Okay, this is the straight sinus. Now when we see in the radiographic image, the same sinuses when we see in the radiographic image. Let us see this image. Now this is a sagittal section, but it is lateral to the sagittal. We say parasagittal sections are there. Now over here, when you see the sinuses over here, on the uppermost side is the superior sagittal sinus. Just below it, parallel to it, is inferior sagittal. And this one, which is shown over here, this is the straight sinus. Now in the image, the transverse sections were given. The transverse sections will be like this. Okay, these will be the transverse sections. So now let us come to the transverse section over here. This image was given in the question. And when we see the transverse section over here, one opening we found, or one structure we found over here, and another structure is present over here. There are two sinuses which you can focus on the posterior side very well. Now this one is the straight sinus, and when you talk about this sinus, this is the superior sagittal sinus. So these are the two sinuses which you can very well visualize in this transverse section. The one which is slightly on the anterior side is the straight sinus, and on the most posterior aspect, coming over here towards the occipital portion of the cerebrum, over here is the superior sagittal sinus. So this section was given. I will show you other images also, so that the chances of any other image which is coming is also covered. If we say, now we have seen this section over here, if we say that the section is going slightly lower or slightly upper, if the section is going lower and it is covering the orbit also, in that case also the point will remain the same. Again, if we see this section, this is a different section. Over here also one sinus over here, another sinus over here, and this is the same thing. Okay, this sinus is straight sinus. Again, this is the superior sagittal sinus. In this section also, another section which is going further slightly below. Again, this section is there. In this section also, I will focus one sinus over here, another sinus over here, and similarly over here, this is straight and this is the superior sagittal sinus. This one is straight sinus. So in any case, if any kind of section is given at the different levels, this arrow marked area is actually the straight sinus. I have given over here one more section. This is actually a coronal section. This is actually a coronal section. The previous sections were transverse. This is a coronal section, and over here again the section which you see at this level, this is the straight sinus. Okay, this is a straight sinus. So this is just for your understanding that the sinus which we are actually seeing over here, any kind of level is there for this transverse section. This arrow marked area over here is actually the straight sinus. Okay, this is a straight sinus. This was a new question. Now coming to the next question, question number 16. Now in this question, the students were having difficulty in recalling the question because the options were slightly difficult, and I've tried to make the question, form the question in my best possible way. Now in this question, two images were given. One image of the bronchoscope was given, the bronchoscopic image. Another image was given from the bronchus. Okay, and it was a schematic image which was given, and the arrow was put, or some students say that some object was shown like this going in this way, and they have said that this point is coming till which bronchus, or the obstruction of the structure is till which bronchus. So let us read the question over here. The question says, a child is playing and he accidentally swallows a toy. The bronchoscopy was done and observed the obstruction, or we say foreign body aspiration. This is actually the foreign body aspiration. The aspiration at the arrow marked region, which is towards the right side. Now the arrow marked region, the students are not very well able to describe, so I have not put the arrow over here. To the best of my knowledge, the arrow should be here, because this is the location where the foreign body aspiration, or we say the foreign body most commonly goes towards this bronchus or towards this segment. We will just discuss about that. And these were the various options which were given. If you see, this is the image of the bronchoscopy. Okay, this is the image of the bronchoscopy. The bronchoscope inside, and this is the level of carina, the right and the left main bronchus. So this was the image. Another image was given for that schematic image. Before that image, you should be knowing all the bronchopulmonary segments of the right side because they focused on the right side. So this is the image which is for the right lobe, and in this if we see the segments, the superior lobe is having apical, posterior and the anterior segment. Middle is having medial and lateral. Inferior lobe is having superior segment which is also known as apical. It is also known as apical. Then medial basal, anterior basal, lateral basal, posterior basal. Okay, total 10 segments are there which are labeled over here also. Now the image was given for this, for the bronchus over here. And if you focus on this image, I will focus on the right side. Now the bronchus are according to the bronchopulmonary segments. If you focus on the superior side towards the superior lobe or the upper lobe over here. So for the upper lobe, this is the apical bronchus, this is the posterior bronchus, and this is the anterior bronchus, which has been labeled over here. So this is for the superior lobe. And when we talk about the middle lobe bronchus is present over here. This is the lateral and the medial segments of the middle lobe, right? And when we come towards the lower lobe, in the lower lobe, this one is the superior or the apical bronchus of inferior lobe, which is the most important because the foreign body is obstructed most commonly over here, and it is going to the apical segment of the lower lobe on the right side. Apart from this, what are the other bronchus over here? The other is anterior basal, lateral basal, medial basal, and this posterior basal. All these are for the lower lobe. And when we talk about this foreign body aspiration, for the foreign body aspiration, most commonly we see in the supine position, which is the most common segment involved, apical bronchopulmonary segment of right lower lobe, and thereby the foreign body is obstructed towards where? Towards the bronchus of this segment. That is the bronchus of this apical segment of right lower lobe. So thereby the answer of this question will be superior, or we say apical bronchus of right lower lobe, right? So this is the answer of this question. And over here, if any other option is by chance mentioned, we have approached this question, and you can solve this question if any other option is given or any other thing is mentioned, but the explanation will remain this, and over here the answer is the superior bronchus of the right lower lobe. So over here we finish the recall of the anatomy questions, and wishing you all best of luck for your results, and keep doing well. My best wishes are always with you.